I don't take nothing that a doctor don't prescribe. I just take Paxil, Xanax, Zoloft, Flomax, morphine, Valtrex, Flonase, Plavix, codeine, Zyrtec, Zoma, Zantac, Ultram, Zocor, Zipro, Prozac, dopamine, Demerol, Lexapro, Tylenol, Vicodin, Lyrica, Lipitor, and Adderall, but I don't do no drugs, man.
Everybody, it's Dr. Beard, and I am joined by one of the excellent health coaches that work for me. Her name is Memory Mayberry. And today we're going to talk about a very, very important topic that does not get much attention. And that is the topic of breast implant illness. I have experience as far as physician working with patients who have had breast implant illness, and Memory has her own personal story that she's going to share. So, but first of all, I just want to go over some facts about breast implants and breast implant illness. The first thing that I want to bring to people's attention is that these breast implants, no matter if they are silicone or saline, are foreign bodies. Okay. And when you have a foreign body within inside your body is going to mount an immune response against that. And it's mounting an immune response against a lot of different things that these implants are made of. So breast implant illness can cause a persistent foreign body reaction, and it's always going to lead to immune dysregulation, no matter what kind. So some people can experience the effects of silicone toxicity because of gel leaks. The capsules are permeable, and I don't think a lot of people realize that. No matter if there's, most often we think, oh, it's just a rupture that you have to worry about. No, the contents are leaking out regardless of any type of rupture because of the permeable aspect of the capsule. The capsules are comprised of a lot of different neurotoxic and carcinogenic materials and compounds. 40 plus different types of toxins are found in these capsules, and you can bet that they're causing your body a lot of damage. There's also what happens frequently is a development of a biofilm around the breast implant. A biofilm is just it's just this thick film that forms, and they can form, you can get them in your GI tract, your urogenital tract, your lungs. And those types of biofilms are there for our benefit. But when they start forming around a breast implant, they start hiding all kinds of pathogens underneath them. And I have seen this firsthand, which I'll discuss later in a patient. And so these things that are hidden underneath the biofilm are exerting influences on the immune system, and not in a good way. There's also these implants oxidize, causing a lot of free radicals and oxidative damage to the cells in your body. So there is a lot of negative effects from having breast implants in your body. And, at the end of the day, all of these things are causing immune dysregulation. And the things that I see as a physician when patients come to me having these in their body, some of them know that they're a problem because the word is getting out more and more, which is so wonderful. Some of them don't have a clue, but there's just a cascade of negative health events from, the development of autoimmune diseases, endocrine dysfunction, hormonal imbalances, gut health issues, mood issues, frequent viral and bacterial infections. And that's just the tip of the iceberg. The 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 list of signs and symptoms that can be mediated by these breast implants is endless. And it differs from one person to another. And a lot of people are dealing with some of these symptoms, thinking that it's just normal, right? Everybody has, hormonal imbalances now. Everybody is moody. Everybody's got a little bit of IBS. And so they're thinking and that's just because we've normalized these conditions. It's common, but it's not normal. And it's not a matter of if your implants are going to cause issues, it's a matter of when. I've had patients who started noticing obvious issues within 6 months of having them placed, and then others, it was years later. But if you have the patient start looking at the timeline of when they had their implants placed and then what symptoms started occurring afterwards, the cause starts to become very, very apparent, or at least one of the major causes of those issues. Of course, it all can't be blamed on implants, because there's a lot of things that people are doing that are, lifestyle wise, that are causing issues too. And so, what I didn't realize when I first started studying about implants and breast implant illness was that there is a 10-year shelf life on the implants, and that's from the day that they are made, not starting from the day they are placed. But I would say I don't even care what the shelf life is. They do not belong in your body. And what's scary to me is that we have a lot of women who get breast cancer, right? And what happens? They have they get radical mastectomies, and then they get breast implants put in them. And we now know that there is a specific type of cancer associated with certain types of breast implants. I believe it's the textured ones that are associated with the breast implant associated anaplastic large cell lymphoma. That's the specific cancer that's associated with breast implants. And you can diagnose that with cytology, just taking a look at cells. So, it's a very serious matter. I remember my first patient that I came across that really opened my eyes to this problem was a woman who had, trouble sleeping, chronic fatigue, GI issues, rashes that would come and go, thyroid problems. And we sat down and did a timeline of when these things started to occur. Lo and behold, and she had some issues prior to the breast implant, but boy, it really took off after she had those placed. And she made the decision to have hers removed. And she showed me pictures that were taken of her breast implants, and they were covered in a black mold. And the mold was on the outside and inside of the breast implant. Again, they're permeable. And she told me that when the surgeon took them out and was taking pictures, and she started getting a lot of phone calls from attorneys if she wanted to, sue the physician, the makers, what have you. I don't know what she ended up doing. But that was like, wow. I posted a picture of her implants on social media at that time. That got immediately taken down for some reason. It was just like, nope, gone. And then I got a big warning, like, don't do that again. And I was like, wow, this is what's going on here. The other patient that I recall, and I saw these two patients within 6 months of each other, probably less than that. This one patient, she was around 25 years of age, beautiful girl. She was really into the fitness competitions, bodybuilding and things like that. And she got breast implants placed. And within less than 6 months, she started having a lot of problems, particularly GI issues, chronic fatigue, trouble sleeping, very, very weak, could no longer do her workouts without, I mean, she just couldn't. She was so tired. And I told her, I said, I believe this is your breast implants. Look at the timeline. And I mean, the light bulb went off when I sat down and showed her that, and she sought out a breast surgeon who does nothing but explantations, and I believe he was located in Georgia, Atlanta, Georgia. She By the time she got there, and I think this, it took her some time to to think about having it done because it's a big deal to have these done. It's not an easy feat from what I hear. And by the time that she had that surgery, she was paralyzed on one side of her body. She had no ability to move her leg, arm, or anything on that side of the body. And she had her breast implants removed, and within 2 days, she regained function of that side of her body within 2 days. Now that's dramatic. And that was just the beginning of her recovery. So getting your implants removed is just the first step, really, in the healing process. And I'm often asked, well, what testing should I do? There is no testing. It's really based on your symptoms, signs, and timeline. And that's really what you have to go after. Sure, there are tests that we can do that show that you have autoimmunity issues and things like that, but it's not going to specifically point to it's coming from your breast implants. So those are just some of the big facts that I always like to share with people, because I think there's a lot of women out there who have been told by their doctors and surgeons that, they're FDA approved, they're safe. How many times have we heard that being said? And lo and behold, it's not the case. And so they think that they are doing something for themselves that is safe and nothing is going to happen. And even most doctors are completely unaware of this problem. And so, Memory, what I want to do now is I want you to share your personal story about your experience with breast implant illness. And so what I want to ask you first is, what type of implants did you get?
So I did not get my actual implants were not textured. I did get silicone because I was told that saline was also safe, but could rupture. If it did rupture, it was naturally absorbed by the body, but there was less risk with the silicone. So I went the silicone route. They were not textured. One thing I did find out after the fact, once I was very sick and started digging and going back and looking, my expanders were what was textured, not the implants that they were swapped out for. So I did have some textured exposure that I was unaware of until I started digging a little bit, but the implants themselves were non-textured silicone.
Okay. And then how old were you when you had yours placed?
So my story is a little different. I was 30 when I had a bilateral mastectomy. And at the time, I was not super natural, healthy minded. And if you get a mastectomy, you get implants. That's the path that you take. It's the only option that's really discussed. It's just what you do. So you have your mastectomy done, you get your expanders put in to the point where you're satisfied with the results, and then you have another surgery to remove the expanders and add the implants. So that's the route that I took because to my knowledge, that's just what you did. So I was 30 when I had my mastectomy, and about 3 months later, my silicone implants were placed.
Okay. And then what did you notice? When did you start noticing new issues come on the scene?
Um,
Was that even on your radar? Probably not. It's probably not on anybody's radar,
no,
right? But
because
now,
like you said, it's safe.
you know, look, hindsight is 2020. So looking back, when do you think you first started experiencing issues?
Looking back, it was definitely around the 6 month mark for
Mm.
me. Um, it wasn't like I just woke up allergic one day. I just had a major stress coming on. I was not handling it well. Anxiety issues were raising, things that were easily written off to situational or just lifestyle or season of life. But I didn't recover from those things. It wasn't like I had a stressful season, my body had some anxiety, and then it got better. Everything seemed to stack on top of each other, and I just kept getting sicker and sicker and sicker. And it wasn't until I was in the thick of it where I look back and realize, okay, it was like within 6 or 8 months that things started pivoting health wise.
Yeah. So you had this persistent anxiety.
Yes.
And then, of course, what do you recall having any other symptoms besides that persistent anxiety?
In the beginning, it was just not handling stress and overwhelm well at all. The anxiety, my sleep wasn't really disrupted in the beginning. Mine was more panic, anxiety, brain fog, um, like memory loss, difficulty concentrating, things like that were in the beginning. Mine was more mental strain there at the beginning, like mental emotional there in the beginning. But I only had mine for 2 years. Within that 2 years, by the time I was ready for explant, the symptoms list was ridiculous.
Yeah. I
It just
remember.
kept stacking on top of each other. Yeah, that's how I met Dr. Beard.
Yeah, that's how we met. You were a patient of ours.
Yep.
Um, did did the doctors ever mention their concern about breast implants to you?
No. So once I realized that it wasn't a season of anxiety, that it wasn't just stress that was making things challenging, once I started really sensing something was wrong, I started going to my PCP and I was like, hey, something's up. These are the symptoms I'm experiencing. I'm not sure what's going on. So, of course, we start running tests, everything, the entire 2 years that I had my implants, all of my labs were normal. They never dug super deep, like doing the autoimmune testing and things like that can be done. But all of my standard lab work was normal. We did EKGs and all kinds of things. All of that was coming back normal. We would try different medications. I pivoted between like 6 or 8 different meds, and things were just continuing to escalate and stack on top of each other, to the point where he was basically not giving up verbally, but he was like, I've done all I know how to do. Maybe it's time to see a therapist. And I was like, okay, we're at that point. So, and I saw a
Yeah.
therapist. I did. I love it. I went and saw a therapist. They felt I had a really good support system and to stick with the medications that were prescribed, and hopefully things would improve. And they never did. So I kept searching, which is what led me to you.
Yeah. And that's not that people don't need therapists sometimes,
Agreed.
right?
Agreed.
But that's often the default when
Yes.
conventional medicine, their pills and procedures are no longer working, or
Yes.
your labs are normal. What's going on? Oh, you just need to see a therapist. I know I was treated like that as well. So I want you to walk us through your explant experience. Like, who did you choose? Why? What was it like? Just walk us through that.
So I used Dr. Eric Wright in
Mhm.
Little Rock.
Who
He is,
was in my medical
yes,
school class
yes,
and a excellent guy.
yes. He's a good human. He's not like just a good doctor.
Yes.
Like he's a good human.
Yes.
I had talked to a couple of docs. I originally actually went back to my plastic surgeon who did for my implants, put those in, and was told that the implants aren't the source of my problems, but that he would explant them if I wanted to, which red flags for me. I wasn't comfortable with that. And so I kind of kept digging, kept searching, found Dr. Eric Wright, and met with him for a consultation. And he, like you said, he's just a great person. He listened, he validated my concerns, and totally, it didn't make me feel like I was crazy. He totally believed me, totally validated what I was saying, and supported me regardless of the decision that I made. I felt safe. I felt heard, and scheduled it for his earliest appointment.
Yeah, he is. And he's always been like that, just very even keel, this kind soul,
Yeah.
and super smart. And you would
Yeah.
never know it because he's so very, very modest.
Yeah.
So when you had your explant surgery done, there's always the talk of a lot of surgeons will leave the capsule, you know, or and some of them are adamant about absolutely this has to come out,
Yeah.
And so did you and Dr. Wright discuss that, and what did you do about that particular situation?
So I don't remember specifically if I even had the option of leaving that encapsulation or removing it. I don't know I don't remember him giving me that option, honestly. I do have another patient of mine that her encapsulation was left in, and she's still experiencing the issues
Yeah.
because that encapsulation absorbs
Yes.
what's being released from that permeability of the
Right.
implants. And so I actually got to see the recording of my explant when he removed the implants. It was actually really cool. And they were both covered in that encapsulation. And he opened it to check for the mold and things like what you were discussing earlier. Thankfully, mine didn't contain mold between the implants and the encapsulation, but you could hear I only had mine for 2 years. And the encapsulation, that protective barrier that my body created to protect me against those implants, as he opened it, you could hear, it was so thick. Just in 2 years, you could hear him cutting through it, which I know sounds awful, but it's important. It's important to know that just in that short amount of time that my body was creating such a defense against that it was that thick that you could hear him cutting through it on the video. It's intense.
And that's the body's designed to do that.
It is.
To protect
It's a foreign body.
Yeah, to protect itself. And it's good that he did do cytology and took samples to send off just to see, especially with the breast implant, associated cancer. It's important to get that cytology report back. And these are things that, you need to ask your surgeon. There's a lot of things that you need to ask your surgeon prior to having them removed. And if you need more information on this, one of the best places I have found is a website called breastimplantillness.org.
Yeah.
And then of course there are support groups and stuff on, Instagram and Facebook and things too, which I'm always leery about recommending some of those to patients because I feel like it just causes a lot more panic and fear. But sometimes patients learn a lot of really good things on there too. How long when you had yours explanted, did you notice improvements right away, or what was that timeline like?
So after my explant, the recovery was at home for 2 weeks and then very limited activity for 4 weeks. And so it was a 6-week, real gradual ease into activity type of recovery. But I stayed home for that first 2 weeks. And I do remember vividly because I didn't notice this, but people notice when they don't see you for a little bit and then you come back. Even just after the 2 weeks of staying home, when I returned to church, I had more than one person that I don't regularly see that just happened to bump into me. And they were like, "Oh, you look so rested today." And, "Oh, your face looks bright." Like I was getting just glowing type messages from other people. And I didn't necessarily see it myself or could tell a difference. Although when I go back and look at photos now, I can see the before and because I took a before and an after.
Yeah.
And it wasn't an immediate. Some women say like they wake up from surgery and feel completely different. I personally didn't. But within weeks, the inflammation in my face, the dark circles under my eyes were eliminated. And I noticed my most persistent symptom was anxiety. That was my first symptom initially when I look back. And so that was mine that kind of took the longest to recover. But at the thick of it, before I had my explant, I was having all day, every day, awful rashes, hives, eating very minimal diet because my skin and my body reacted to everything.
Right.
That
Food sensitivities. I'm glad you brought that up.
Awful.
Yeah.
Awful. Like I literally was doing baked chicken and steamed veggies and still having like, and that was my diet all day, every day, and still having reactions and things like I couldn't eat anything when I had zero food sensitivities or allergies prior to having implants, no food issues prior to that. And then as it progressed, I was allergic. I tell my husband I woke up allergic to the world. But yes, that turned around pretty quickly. My skin cleared up within just a couple of months. My hives were gone. The food sensitivities improved, although still to this day, gluten is a no-go for me unless it's homemade sourdough. And dairy is hit and miss. But otherwise, my food sensitivities are gone. My rashes, I don't have skin issues, haven't since. Lots of things improved pretty quickly, and a couple of things just took time.
Yeah.
And then there's some things that just never improved because in that just that 2 years that I had mine, it dramatically affected my system.
Yeah. And the body takes time to heal, especially when you have something as toxic as breast implants in your body. And that's not even, and what I see with a lot of other women is not only do they have breast implants, but they're getting all kinds of cosmetic procedures, injectables, the beauty products they use are toxic. They're not eating,
Botox.
clean diet. Yeah. And so there's just a lot of other things that they're doing in their life that are just adding to that toxic burden. And so that's why a lot of people get very frustrated when they have their breast implants removed and they're not better.
Yeah.
Like, why am I not better? Or I felt a little bit better. And so it's because you're doing a lot of things that are going to prevent your body from detoxifying. Right. And you're just continually adding to your toxic burden. Although you've gotten rid of a huge amount of toxic burden by having them removed, there's often a lot of work that still needs to be done. I'm a firm believer in if you give the body what it needs, remove what it doesn't, and have a little patience and be very mindful of what you're doing day in and day out, your body will heal. It was designed to heal. So I kind of want to talk about what we have going on right now, and that's in the works, and that we're getting very close to finalizing, and that is a breast implant illness group coaching program.
Oh, support group coaching, yeah.
Yeah, and you and I were talking about this, and I could not really find anything out there that was there wasn't this service that I could find.
There's like Facebook groups and things like that.
Yeah.
But there's not a coaching safe place environment set up.
Yeah. I mean, there are places where you can go to detox, there's like spa detoxes and stuff like that. But who let's face it, those are very expensive.
They are.
And you can learn a lot in 30 days, but don't think that you're gonna, be all good in 30
Right.
days.
Right.
From
Nothing's cured in 30 days.
from your spa experience in Sedona.
Yeah. I
Which
would love that.
I'm not, I would love to do that, not gonna lie. But
But it's not practical,
no, it's
not for
not.
longevity.
It's not necessary.
Right.
Because what you need to do to heal from your breast implant illness, the foundations of this are something that's not just temporary. These are things that you need to
Lifestyle.
be doing for the rest of your life for
Yes.
good health. And
Yeah.
so we jumped on, I think, this opportunity to help people who are trying to heal from this illness. And so tell us what first of all, how big is the group size that we're talking about for this program?
So we settled on me plus 4 to 6 members in each session. That way, we don't want to do too many because we
Right.
want to have an open dialogue where people can connect and share stories and lean on each other so that you don't feel isolated. After my explant, it was like, Dr. Wright was wonderful, but post-explant, there was no support. There was no resources. It was just your surgery is done, off you go. And so I wanted a place where people could lean on each other and connect. So we wanted to do 4 to 6 because it gives a few to where we can learn from each other, but not too many that we can't have an open dialogue.
Right. And I think I'm a big fan of group meetings when there's a special issue at hand, just because the support and encouragement, and you're hearing, oh, I'm not alone in this. This person is struggling with this as well, and this is what helped them, and I just think it's a great place for healing. I think having a community of people kind of in the same boat, but headed in the right direction is going to just help the healing process.
Yeah, absolutely.
And so what topics are going to be addressed in this program?
So we are going to discuss symptoms, things that you can and may be experiencing either pre or post explant, food and how it affects your inflammation, better or worse.
Gut health, right?
Yes, gut health, ways that we can address that gut health with our food, sunshine, quality water, getting back to the basics, the things that our body needs at its core and at its root, things that it was created to thrive on. We're going to discuss what those look like and the importance of those.
Yeah, and I know people, it's often, we do this with our functional medicine patients, right? We're telling them, you got to get outside, you've got to eat clean food, you've got to get good sleep, you've got to get off your phone, you've got to sweat. And it seems so rudimentary, but these are the things that are going to help your body heal. I feel like they are the absolute foundations.
Yes.
And part of anybody's health journey, regardless of what you're going through, but particularly for people who are dealing with breast implant illness. These things are what's going to help your body detoxify itself from all the things that it's been exposed to with the breast implants and other things that you may be doing unwittingly that are also mediating some of the persistent symptoms. Some of them may not be related to your breast implants, but things that you are doing, that the body does not like.
Right.
So when we were first talking about this, and some of the foundations that we're talking about here is gut health, restorative sleep, the HPA axis and nervous system regulation, which is a big one.
Yes.
Really big. Gut health for me is like right up there because that is your immune system, but your nervous system regulation is right there neck and neck with it. And your body is not, we have divided it up into different organs and different systems and treated it like that in the allopathic method when it's all interacting with each other in so many marvelous ways, right? But regular movement, sweating, hydration, reducing your toxin exposures. And are you aware of what toxins you may be exposed to, And then, of course, regular sun exposure. I can't stress that one enough either. The sun is literally medicinal.
Yeah. I tell my patients, humans are like little solar panels running around. And if we don't charge, then you feel the effects of that.
Yeah, you do. So those foundations will be covered, in depth, and you'll be getting I feel like really good information from qualified people. I know you can go on the internet or social media and it's just, everything is so conflicting. And people are like, I don't know what to do or who to trust. Well, I've been at this for years now. I've been a functional medicine physician for a long time, even had my own personal history with, having autoimmune issues, and was able to overcome it using these foundations, this functional medicine approach. So I know hands down it works. And we work with patients all the time who come to us and they're just downtrodden, hopeless, have felt terrible for a long time. And you start incorporating the foundations and being consistent and having that support, and they start thriving again.
Yeah.
And it's why we do what we do.
Yeah.
Right. It's why you became a nurse. It's why I became a doctor, to help people. And I feel like this functional medicine approach to health is the way that you truly help people. And what you have learned through your own experience, what I have learned through my clinical experience working with breast implant illness patients, I feel like we've learned a lot, and we've been able to help a lot of people overcome this illness and go on to lead healthier and happier lives. So, one last question. So if, and there will be other things discussed other than like the foundations, because there's all kinds of alternative and adjuvant therapies that people have found to be very beneficial, whether it's hyperbaric oxygen, saunas, red light therapy, colon hydrotherapy, which I know you have done. I can't, because I only have 18 inches of colon and no ileocecal valve. So
that would not be good.
That would not go well for me. But castor oil,
liver, gallbladder cleanses.
I've done that. You've done that. So we're not going to be treating people like guinea pigs. Everything that we're going to ask you to do are things that we have done ourselves. But there are always going to be people when you go through this program. And if you go through, like, if you're a patient of ours, people see improvements. And then there's just some lingering issues. And so those patients who go through this program, if there's those lingering issues, what are their options?
So my thought process for the patients that get through this program, see the improvements, see the changes, they're feeling better, they're happier, they're healthier, but they kind of plateau, or maybe they want to take things a little bit further, or they're just not quite where they want to be yet. We could do several things. The liver gallbladder cleanse, like what we discussed, if we haven't already done it. We could do a heavy metal detox, would be huge, because you're exposed and your body it absorbs all of that. And so we can definitely, the way that the program is set up, it's a group program, but at the end there is an individual appointment with just one-on-one, me and the patient, where we can chat and discuss where they're at specifically. Yes, where they want to go, and then the options that we have where we can just further their health journey and continue setting up their body for healing and recovery.
Yeah, and sometimes, you can go through this group program and you may still have issues, but it's just a matter of time, just continuing incorporating those good foundations in your life, and just letting your body continue to detox and rebalance itself. And that It does. I know this, you know this. I've gone through a lot of health struggles in my life, and I feel like that's what helps me become a better physician. I understand, and I also know that the body takes time to heal, and you can't rush it. But like you said, some people just need more extensive, intensive detoxification efforts, like whether it's heavy metal detoxification. And whenever you have a lot of heavy metals, you typically have a lot of parasites.
Yep.
So parasite cleanses can come into play. And so those things like that could be potential options after going through
Absolutely.
the group program. All right. Well, is there anything else that we've not discussed or anything that we've left out? I feel like we've done a pretty good job.
I think it's gone pretty well. I did want to say, because I do know some people that the mindset is, well, I've had my implants for 15 years and I'm okay. But me, within 6 or 8 months, I was having issues and then had to get them out within 2 years because I was crippled. My advice would be to honestly and thoroughly examine your life and your quality. Are you feeling good? Are you feeling rested? When you get sick, do you stay sick or do you recover well? Are you on a ton of different prescription medications that are trying to cover up symptoms and help autoimmune? Or I'm having joint pain, so I need to do that. Like, is there a lot of things that you are excusing that could potentially, breast implants are not, like you said, they're not the sole thing that are affecting everybody, but look at your timeline, be honest and examine and say, okay, could this be because of this? Or at least, it's making it worse. It's a foreign body that your body it's going to put your body on high alert, and it's going to be sensitive against that and put it in that fight or flight mode, that at some point it's not going to be able to manage that anymore.
Yeah. And that's why I bring up the fact that it's not a matter of if, it's when.
Yes.
And a lot of people say, I feel just fine, but what does fine really mean? Because
Right.
I think people have made a lot of chronic issues that aren't normal, but they've normalized them because we
Right.
live in a sick
Getting
society.
older.
Yeah, you're getting
I get
older.
that all the time. Oh, I'm
It's
getting older.
your genetics,
No,
please
no.
don't fall for that. And so, yeah, I'm glad you brought up that point. I just feel like they do not belong in the human body, and it's only a matter of time before they start causing
Absolutely.
problems. All
Absolutely.
right. Well, thank you so much for joining me, Memory,
Thanks
and
for
having
having me.
this very important discussion. Our goal is to have this program ready, hopefully within a couple of months,
Yeah.
maybe
Yeah,
soon.
it'd be great. First of the year, maybe.
Yeah, first of the year, maybe. We just want to make sure that we've got all of our ducks in a row and all the details worked out, and that we launch successfully and that people have a very good experience. And so I'm looking forward to this program. It's much, much needed, in my opinion. And you are the person to lead it. I'm just saying, guys, Memory is a rock star when it comes to functional medicine health coaching. And I could not do what I do at our practice without you. And the coaches are such a critical component of getting people healthy. And you do a great job. And you're just one of those very empathic, caring people who just goes the extra mile for your patients. And I'm very blessed to have you on my team.
Yeah, thank you. I'm excited to be here. I never thought that journey would lead me to being on the team and getting to use my pain and my experience and my struggles to turn around and help others. But I'm so grateful for it.
Yeah, I know. It wasn't fun going through, but
it was not, but at least I'm making it useful.
Absolutely. And that's often the case, right?
Yeah.
Well, you have a great day out there with your chickens and your goats and your farm animals.
I know you can see, there goes somebody.
I've got mine out here, but they're in the window and you can't see them. I'm seeing my roosters, walk around. But you have yourself a great day.
Thank you so much.
I don't take nothing that a doctor don't prescribe. I just take pack sales and